Welcome to Facebook Live. This is Dr. Charles Bradley of Domino Veterinary Hospital. Thanks for coming in and visiting us here this Friday. We hear a lot about different things that you can do for a pet, and I'll hear a lot of people say, is dentistry worth it for animals? Is it a scam? Is it even worth it? It's so much money, and why would I put my pet under anesthesia? And I would like to represent the cause in a court of law for, yes, dentistry is worth it, and it is not a scam. So let's start right now. Let's have a look at this model here, and let's look at factory fresh. I don't know if you guys can see that. There's factory fresh. The gums are all uniform. Everything is good. We can see the whites of the teeth. Now let's fast forward 10 or 15 years in a terrier's life, say, and let's go to not factory fresh. Look at that. I don't know if you can see that. Yeah, there you go. See that? These teeth here, they are rotting out of the head, and that's what happens. We don't want that to happen. Look at the difference. Look at the difference. This is the good side, and this is the bad side. Now, why would we even care? Pain. Pain and suffering. Do we want our pets to suffer in silence? No, we don't want that. I had somebody come this morning and she said, I'm glad that we did the dentistry. We didn't talk about the anesthesia, we didn't talk about the fees, we talked about how the pet benefited. And she said, you know, I don't know if my pet, I didn't really realize my pet was in pain. So pain and suffering, that's what I'm very concerned about. Now, all of this infection here, which I'll point out with my pointer, this is 80% bacteria all in here. This is really, really bad stuff. That's going to go up into the bloodstream, and it's going to visit with the kidneys. A lot of this blood has to be all of this blood actually has to go through the kidneys. And at any given time, the kidneys are processing an awful lot of blood. So all of this bacteria goes to the kidneys. Guess what? The little kidney cells get destroyed by this bacteria. We don't want that. We want our pets to live long lives, don't we? We also want them to live pain-free. So periodontal disease, which is what gum infection is a bad thing. So let's talk a little bit about what we do to clean a pet's teeth. So I'll show you some of the tools that we have here, and I'll use a dog skull. If you're afraid of this, you can sign off. But this is an actual dog skull, and it shows the teeth. Now what I want to do is I want to get the cleaning happening between the tooth itself and the gums. We don't want anything to happen there. It'll probably show up better on this other one. So when we are brushing teeth, we are trying to get all the plaque, all the bacteria off of there. We don't want any of the bacteria to live there, because then we get an irreversible situation where we lose teeth. This costs a lot of money to take all those teeth out, and guess what? Spot or Fluffy can no longer chew food because the gums are there and the teeth are gone. So we don't want that. So what we do, I'll show you some of the tools of the trade. We will take these fine instruments and we'll actually clean below the gum line just like a dentist does. In fact, this is more like periodontal surgery. So when I have a patient under anesthesia, I can do whatever I want, whatever's necessary, whatever time permits, to try and both take this pet out of pain and get rid of all the infection, because most of the problem is right there below the gum line. So cleaning the tops of these teeth, a quick buzz for a few $100s does nothing for the pet, because you have beautiful crowns that are all happy, but the gums are very unhappy, and that's where all the infection and all the pain is. So we want to clean below the gums. Now what can we do? Actually, before we get there, let's talk about extracting teeth. Kind of a negative, but we have a whole set of tools, and this side here, we are spending money to get rid of teeth that could have been saved. And sometimes it's so bad that they just come out, they just like fall out, they exfoliate, because that's what 10 years of not brushing will do. So let's go to some prevention. Let's have a little bit more of a positive tone now. So we have factory fresh. We want to stay factory fresh. How can we do it? Now I'm going to speak specifically about a dog. I don't know if you can see that, but I want you to see that as we go back, the teeth drop right in. So if we look at it on the side, this is the nose, and these are the ears. Right where my finger is where the eye is. So when you are brushing the teeth, you have to pull your fingers in behind the eye. So most people are really good about brushing the very, very front here, but underneath the eye where this bulge is the most important part. And notice on the bad side, that is where all the calculus and all the bad stuff is happening. So you have to drop your finger. Watch this. See how my finger drops right in? That's what we need to do with the dog. So brushing the teeth is a really good thing. We'd be happy to teach you. If you want to call into Domino Veterinary Hospital, we can talk about that. We can do a dental assessment. Now let's talk a little bit about some of the tools. This is the brush, and we looked at this before. This is a little bit harder to do. If you want something easy to start with, how about that little finger caught? And these are little bristles right here. And these little bristles will contact the gum line. And you can just kind of tuck your dog in like this into your body. Your dog can be facing away from you, and they don't really mind if you just flip the lip and you go along the gum line like that. And just as another prop, here is chicken flavor toothpaste. And we use it as a treat in the animal hospital. It's so palatable. So this is an overview of veterinary dentistry. I think it's really important. I emphasize it a lot in this practice. It's not for everybody. Not everybody wants to make that investment. But I think the benefits for the patient are amazing, especially with cats, a special word for cats, because they get something called resorptive lesions. And those lesions are very, very painful. We'll pretend that this is a cat. And if we just touch the tooth, just with a probe, the jaw will chatter. So what that looks like is, if this were a cat and somebody were to touch one of these teeth, it'll chatter just like that under anesthesia. So that tells me how painful it is. So the goals are prevention of pain, longevity of life, and there's so many benefits. If you want to talk more, if you want to have your pet assessed, please give us a call at Domino Veterinary Hospital. Kelsey, do we have any questions?
No.
Okay. Well, we're going to see you next time on Facebook Live. Thanks for joining me. I'm Dr. Charles Bradley.